Van Pelt, and we talked earlier or before about diabetes,
Right.
and it kind of opened the door for more discussion. And those people that we've talked about, they might be skinny fat or they might be thin, and they might have type 2 diabetes. You said pretty much you're pretty confident if someone's overweight, if their waist is big and they're significantly overweight. You said that, correct me if I'm wrong, you said that they probably are what, insulin resistant? Or
Hmm.
what was that you said, if they have the big waist?
Yeah, yes, that they are insulin resistant. Yep.
Okay, which is leading to diabetes. So, how would one know, or how would one suspect that, I mean, other than, seeing your doctor and all that, how would they suspect that they might be diabetic and they're on the wrong track? How
Yeah.
how, how do you
Yeah.
diagnose it if you're self-diagnosing, I guess, so to speak?
Well, right, that's a good point. We can start at home. Okay, right. And I think that's a good place to begin. But I think we can't afford to just rest on that. Okay, because I'm going to tell you right now some physical measurements that we can do that will, give us a strong idea of um, whether we are, well, really insulin resistant, which is pre-diabetic or diabetic, and so these are helpful clues. But because 25% of those with TOFI, thin on the outside, fat on the inside, because 25% of thin people have TOFI, like you can pass the physical test I'm going to give you just now, and you could still have a problem, So we want to we need to do some other testing, and generally speaking, more testing than is usually done. They're not testing the right things in conventional medicine, where they're missing some important things. And so let's talk about how it's conventionally diagnosed. First of all, diabetes, and that's usually with a fasting blood sugar. That's usually what is being looked for. So you can go into your doctor, and even if I was, 75 pounds overweight and struggling, with my weight and not feeling good, and I'm tired and I'm aching, I have arthritis, he'll probably run some tests and do a fasting blood sugar. And if that fasting blood sugar is under 100, he'll tell me you're normal. If it's 99, he'll just say, "Yep, you're fine. Your labs are fine for diabetes. Not there." It's between 100 and 125 where they'll tell you you're pre-diabetic, and if your fasting sugar is above 125, they'll tell you have diabetes. Well, and I would submit that's uh, a faulty look at it. Okay, the person can, because they're not looking at insulin levels for one. Some people, you see, type 2 diabetes is characterized by really high insulin levels. They, we remember the type 1 diabetics, they don't make insulin. So they have very low insulin levels because they can't make it, or they make way too little. And so their blood sugars go high because they don't have enough insulin. With Paradoxically now, with type 2 diabetes, it's characterized by really high levels of insulin, okay, and high blood sugars. Now, those shouldn't go together. How is it that high insulin and high blood sugar can go together? Because insulin is what's used to bring blood sugars down. It's because our bodies have become resistant to the effects of insulin to allow sugar to come out of the bloodstream and into cells. So that is what we refer to as insulin resistance. And so there's these really high levels of insulin, and the body keeps making more because the sugars are running high, because the insulin doesn't get to work because our bodies are resistant to it. But so those insulin levels are, I mean, really, really rarely being tested for. Doctors hardly test for it. When I was doing conventional medicine before I understood these principles, I didn't order insulin levels. I'm not sure I ever ordered an insulin level, on a patient, to evaluate them for diabetes or, or just a general health evaluation. I just never did it. And we need to. So there's blood sugars. We talked about that. Turns out that fasting blood sugars, ideally, we want it to be between 70 and 80. That's an ideal fasting blood sugar. If it's 95, that's way too high. Conventional medicine will say, you're fine. I'm submitting, that's too high, and it's indicating I have a problem already. Hemoglobin A1C, this is another thing that conventional doctors order. Certainly they follow their diabetic patients with it, but allow them to be too high also. We want that number, hemoglobin A1C, to be below 5.5%, preferably below 5%. Really, ideally, it would be 4 point something. And this is just measuring how much sugar is attached to cells in our body, red blood cells. Really, it's sugar gets stuck onto it, and just from blood sugar, and when we run high blood sugars, the percentage of hemoglobin that gets sugar stuck to it increases, and so we can kind of follow long-term trends of high blood sugars by using hemoglobin A1C. Insulin levels is an important thing we want to check. Now, that's something that you'd have to ask for probably from most doctors, and they might not be willing to do it. You might have to go to a kind of a functional medicine doctor or a natural medicine doctor of some sort to get that test ordered. There are ways anymore where you can order your own blood tests online. And so you can check into that also. But so insulin level, I can look at a fasting insulin level. I want that to be less than 5. Okay, if it's 10 or 20 or 70, okay, I'm having a problem. My insulin levels are running too high, and high insulin levels are a problem for the body. It causes inflammation and other problems when it runs too high. So we want to know it, and definitely it's indicating that prediabetes or diabetes is going on when my insulin levels are high. And see, if I'm checking insulin levels, I will diagnose prediabetes maybe a decade or 2 earlier. Okay, this is why I said we're often testing the wrong things. If all I look at is blood sugar, I might miss the diagnosis of prediabetes. I might delay it for 10, 15 or more years. Whereas if I look at the fasting insulin level, I'll detect it, just way earlier, and I can know and do something about it right then. Insulin response test is another thing that can be done. It's like a glucose tolerance test, only where they give you a drink of really kind of sugar water, and then follow your blood sugars from fasting right before you drink it, and then they check it at timed intervals after that, up to 2 hours. In this case, we're looking for insulin levels. Okay, and we want it to be less than 5 fasting, the insulin level, and at 1 hour less than 30, 2 hours less than 30 again. So then there's an interesting physical test we can do, and that is the waist to hip ratio. The waist is kind of our measurement around our middle, about where our belly button is, but mostly we're looking for the widest, the widest part near the belly button. That's what the waist measurement we're looking for. The hip measurement is the widest area below our belt. We're not measuring at the belt line. We can often kind of get a little bit skinny right there at the belt line. Where our belt goes, we kind of put it under our gut often. And anyway, so we're looking for the widest part of our hips, and the widest the largest part of our gut, okay, which is up near the belly button line and above where a belt would usually go. So this is the waist to hip ratio. And for men, we want that ratio to be less than 0.9, right? Less than 0.9. And for women, we want it to be less than 0.8. In other words, we want our middle, my gut, to be smaller around than my hips. Okay, like for women, it's like that natural shape. It's that shapeliness is somewhat less far around in the middle and somewhat wider at the hips. And we expect more of that in a woman, in a female, and just because of genetics. This isn't about cultural, preferences. This is just genes. The differences between men and women is that women tend to have that wider hip and somewhat narrower abdomen in a ratio to each other. So the waist hip ratio winds up being lower for women to be ideal for diabetes, right? That's where we don't tend to have diabetes. Anyway, that's a measurement we can do at home. The waist to hip ratio, less than 0.9 for men, less than 0.8 for women. For men, it's a danger if it's over 1.0, and for women, if it's over 0.85. That's when they're getting into the danger zone for diabetes.
Well, I have one more question.
Yes.
So, other than that, that's a good way, but is there any physical symptoms that maybe somebody's having, like being tired or certain things that might indicate, other than those measurements, that, hey, I need to request from my doctor all those tests that you mentioned. I need to investigate this. Is there any symptoms or ways that somebody might be feeling that would indicate that they should, request these tests?
Well, you know that that's a really good question, Steve. And people with diabetes, okay, if I'm obese and and have insulin resistance, if I have diabetes, chances are really high I'm not going to feel good. Okay, I'm just basically not going to feel good. I'm going to be tired. I'm going to be depressed. I'm likely to be, like, I can be any one or any combination of these things, not necessarily every single one of them. But diabetes absolutely promotes depression, and fatigue. If I have heart disease, if I have arthritis, it promotes inflammation. It's an inflammatory condition. Diabetes is an inflammatory condition. So and inflammation is the underlying root of almost all uh, diseases in our body. So it wants to promote just about anything. So generally, if I'm just not feeling good in one or many ways, um, it's a possibility. There are some specific symptoms to diabetes. My experience is they're rare in type 2 diabetes. These are more common in type 1 diabetes, but you can get uh, where you are peeing a lot, but your blood sugars have to be really, really high to
Hmm.
to do that, like 400, milligrams per
Wow.
deciliter, before it's causing this, what in medicine we call polyuria, meaning you are making lots of urine. And then people are very thirsty in that condition, but it's rare. But if a person is just thirsty all the time, peeing all the time, it those are symptoms of out of control diabetes. But I wouldn't rely on that because
Right,
most
right.
of us are beneath that threshold of blood sugar.
Okay, so from our last video, we talked about causes of it. So if you're someone, or if there's someone listening to this, or you know someone listening to this, who's eating a lot of flour, like you said, like we talked about, um, um, a lot of flour, like what the average American's eating, if they're eating a lot of that and a lot of sugar and they don't feel good, there's probably something wrong and they should look at these tests. Would you say that's accurate?
Um, you've put it well. Yes, I think that is true. And I would add, I think that especially if you have abdominal obesity, if you're fat around the middle, that is to say you fail the waist to hip ratio test. Okay, especially if that is in conjunction with it, I would look at it. But even if I don't have a lot of symptoms, I want to diagnose this early and intervene. I don't want to wait until I have a lot of symptoms. I don't want to wait until I have heart disease, or a stroke, or, I want to intervene as early as possible. So I want to know even before I have symptoms, if I can, just really, really early on. I want to know. And so I'm going to look as early as I can. But just as you said, if I'm eating the average American diet, I have belly fat, I'm not feeling good, I want to figure out whether I have prediabetes or diabetes and do something about it.
Okay, yeah, that's great. So anyway, I guess you're also saying get the tests, request the proper test from your doctor. I'm getting my blood work done all the time, at least 2, 3 times a year. So I guess that's a big deal. Request those tests that are going to help us accurately determine where we are. Um, so let's come back and let's talk about, we've said, okay, here's what the cause is and how if you might have it, but let's come back and talk about what do you do? What do you do? If you have this problem, because I know there's things that you can do. So we want to come back and talk about that. So thanks for being with us, doctor, and we will talk soon.
Adios.